Hello, my name is Heather. I'm a lifelong West Virginian and I'm a social worker. I primarily focus on people with disabilities and issues related to aging in my practice. When I was 11 years old, I was in the hospital and a rehab center for several months after I became a wheelchair user related to medical malpractice. Some of my happiest memories from that time of my life are of being visited by the medical social workers and the facilities where I was a patient. I know that they provided my parents with a lot of support as they were learning how to be parents to a child with a physical disability. And the social workers also helped me to envision a future for myself. As a child with a disability, there really weren't many role models of people who were happy and successful, who looked like me and lived their lives the way that I did as a person with a disability. It was often hard for me to imagine that I could ever have a career or even live independently. The social workers who worked with me while I was a patient and then on an outpatient basis throughout my adolescent years really helped me to realize that I still had a place in this world in a meaningful way that I could contribute to the world. I went to undergrad with a major in geography. I was very interested in rural issues, especially related to rural disasters. An example being the serious floods that happened in southern West Virginia in July of 2016. After I graduated from undergrad, I joined AmeriCorps and I served for 2.5 years in AmeriCorps. That was a great experience, getting some hands-on work related to disaster recovery in our state following those floods. After I finished my second term of service in AmeriCorps, I decided that I wanted to apply to grad school to become a social worker. I didn't consider social worker as an option for myself when I was younger, mostly because I had been warned off of it because social workers didn't make very much money. But I realized serving in AmeriCorps, where it's not salaried, you're a full-time stipend volunteer. So I was really living very bare minimum, and I was very, very happy serving communities and developing my skills in that way. And I realized that it was more important to me to have job satisfaction and to feel like I was making a meaningful contribution to the people around me than it was to have a super high salary. That said, I have learned that the salary that comes from being a social worker isn't as low as I once thought that it was. Um, I then decided to enter the MSW program at WVU. The time I started the program, I was leaning more towards macro social work. I've always been very interested in policy and advocacy, so that's kind of where I was leaning. But for my first field placement in the MSW program, I got to intern at a nursing home, which wasn't something I had ever really considered. I don't think I had even realized that nursing homes had social workers until that point in my life. But I really enjoyed working in a nursing home. It was a facility that had a large and vibrant rehab unit. So a lot of my patients were people who had just recently acquired disabilities. And I remember going through that when I was young. And although I worked hard not to allow my personal feelings and memories to become an aspect of my treatment of those patients, my patients recognized that I knew what they were going through because it was very visible to them that I had been through something similar because my disability is so obvious. So, in that way, I kind of feel like I've come full circle. I'm now working in disability services at a university, and I really enjoy that. I'd like to get back into a more clinical setting or a medical setting at some point in the future, but this is a step in my career that I thought would be really helpful for me. I'm looking forward to continuing to grow my skills as a social worker and continuing to treat and to serve people who or experiencing new onset disability and learning how to manage those things.